I'm Dr. Rick Hyde. I'm going to go through lower cross syndrome. This is near and dear to my heart. I've got a testimony about an hour long about how God had led me to be a chiropractor through the first chiropractic school in the world, and then led me from there after my first prayer to lead me to National Health Science University. The story is amazing, and it had to do with lower cross syndrome, where the top physiotherapists, the top chiropractors, the top surgeons couldn't figure out all my issues, tendonitis and hip and back issues. I get to chiropractic school, they figured it out, but they could not actually develop the plan to fix it. So I'm so grateful for all of them to get me into chiropractic school, where I played 3 sports in college and developed all these muscle imbalances right near the first chiropractic school in the world. Adjustments were great. But then when adjustments and therapy and rehab wasn't working only, it was because my muscle imbalances and my patterns weren't. All right. Story is amazing. All right. Where I prayed, God the Father, God the Son, God the Spirit, where do you want me to go to school to fix my tendons? And I was ready to go to the first chiropractic school in the world because of the awesome treatments and philosophy and people, which I'm so grateful for. And then I felt led, so it's Palmer, and then I felt led to go to National Health Science University right there, where all my parents' diseases happened the exact same time as I studied it. And I did failed surgery by the Chicago Bears surgeons. They want to cut my hips in half, cut my tendons off at other surgeons. They actually cut the tendons off the lateral retinacular releases, made the kneecaps floppy. And I get to school, and the guy figures out the problem. Now, he didn't know how to develop the program to fix it. So the guy who developed lower cross syndrome was there, and the people who he trained. So, and when none of that worked as far as the treatment, I had to develop my own plan. But I'm so thankful and grateful for all the different doctors that were involved in analyzing, in detecting, and correcting this issue. Okay. So let's go ahead and start. What is lower cross syndrome? What is it? Well, it's a cross in the lower half of the body. This is the upper, this is the lower. Upper cross is here, lower cross is here. It crosses because the muscle imbalances or the posture is the hip flexors are tight, the low back is tight, maybe due to sitting, maybe due to sports, maybe just due to posture or genetics. And then it's because these are firing when you're walking, these things shut off completely. All right, so what happens is you might have longer hamstrings compared to your quads and hip flexors. So what we do is a muscle balancing full body range of motion and flexibility assessment, comparing front versus back, left versus right. Now, just like this, if you're right-handed, your eyes go even, it adapts. Just like this, it adapts. Okay? So what you want to do so that's what lower cross syndrome is. How does it happen? Like I said, muscle imbalances. I played 3 sports in college, quad dominance, sitting a lot, and maybe even the wrong rehab plan of stretching your hamstrings a lot. And then this comes forward, and then you get this. Okay, different motions. Okay, so now when we get lower cross syndrome, that's what it is. How does it happen? Okay, what's the solution? Well, the solution is to stretch and lengthen the tightened muscles, strengthen the weak muscles. Okay, so the adaptation again is a twin is like this. She's got blocked nerves on the breast nerve on x-ray. She gets breast cancer. The other twin doesn't have it. The same genetics, nutrition, diet, and exercise. A study that I've done. Okay? Groundbreaking. And she had a genetically fused vertebra from birth in her neck that wore out her breast nerve. Now, I have a genetically fused vertebrae in my low back that caused an increased Q angle as well, or increased lordosis, but also too genetically had an increased Q angle that they said, oh, you just have this in Olympic sprinters, because I would play 3 sports in college, was getting looked at. And my dad had the exact opposite posture though, but they said it was genetic. And I'm like, well, it wasn't genetic to cause these issues. I didn't always have them. So you can reverse them to where it's not pathological. Okay. So we're trying to get to a normal state. So doing the therapy and rehab plans that I was told after they said, well, we can't fix anything at Health Science University. Go do some stretches. I got a book, Herniated Discs, doing like bending over, touching my toes, trying to stretch my back. Now, they didn't recommend that. I just was trying to fix the low back pain that I had in the lower cross syndrome. But until I functionally changed the neuromuscular patterns, it didn't work. All right, the testimonial is there. It's about an hour long of all the different diseases and symptoms and tests, not just me. That was very quick. So what is it? How does it happen? What do we do regarding that? Now, the full body range of motion and flexibility assessment, again, comparing front versus back, left versus right, about what is tight abnormally and what is weak abnormally, and what is firing in different patterns abnormally. And then how we restore that and how do we measure it? Well, the first test is we do that full body alignment, the AFMB, we call it the Hyde method, flexibility and neuromuscular tests. Then we take x-rays to look at the curves in the spine. Why do we do that? Because your discs are made of 90% water and there's arthritis, joint disc. Remember, muscle imbalances become a joint problem, become a disc problem, become a ligament, tendon, muscle problem, become a nerve problem, and eventually become an organ problem. Okay? And this is what we want to avoid. So that analysis on our x-ray analysis is going to graph the disc heights, look at the alignment and the curvatures, and the therapy is we're going to reevaluate that from start to finish to make sure not only your symptoms are gone, but the mechanics are there properly to properly evaluate that there's not going to be further mechanical issues. Remember, your left, if it's higher, and the right side, we just had a person leave today, that left hip was high, his left knee meniscus crushed down to even it out. And then plantar fascia on the right side. And that right low hip is usually the external right hip replacement. People come in and say, you know what, I'm fine, I walk an hour a day. Because there are muscle imbalances, I'm like, you're skinny, but let me take an x-ray. Guess what? The muscle imbalances created a low hip. That low hip needs a hip replacement. And they just had a little muscle pain. So this muscle imbalance stuff needs to be addressed to see what those effects are with the joints and the discs and eventually, potentially, nerve flow. So now your knees are made of 70% water, your discs are made of 90% water, and they collapse 90% quicker than all your joints. And arthritis can form in bone chips, blocking nerves, and spinal stenosis, and all the different effects of these muscle imbalances as your gravity in your spine shrinks. Now, your water in the cartilage in the shoulders, hips, elbows, and feet have no water in the cartilage, so they don't degenerate. Doesn't mean the cartilage can't degenerate, but they don't degenerate like a spine and knees. So these effects are huge. So fixing the lower cross syndrome fixed my tendonitis in my knees because of a mechanical issue. How'd that work? The increased Q angle created by the lower cross syndrome made my valgus knee stress to go out and too much tension on the tendons. Okay? All right, so what are the patterns that we use to analyze that? We're hesitant to start to go through how and what we do specifically because we want to tailor this. But know that this is how you're going to accurately do this, okay? And address all the major issues down the road that are affected by lower cross syndrome. So God bless. My name is Dr. Rick Hyde.